I'm Shayama Nagarjuna, basically a pediatrician by training, and then did my master's in hospital administration and a master's in public health. I have seen two sides of the same story. I have earlier stayed in a place like Sambalpur, which was very clean, unpolluted, good environment. And from there I came into a city like Delhi in '94. And from there on, when I saw Delhi at that time, the pollution has reduced from that time in 2000s, once the CNG and other. I remember the days when in '94, '95, you would wear a white shirt, go out and come back, it is completely black. From that, we have actually traversed far and we have done well for ourselves. But now the pollutions are again going back and I have hardly seen any stars from the time I came to Delhi. I used to have a starry sky. We used to, as kids, we used to identify Saptarishi and Great Bear and things like that in the sky. But today you're not able to do that. You see an orangish grey sky. So the pollution levels are still high. We have done good, but I think it's too high. So although I'm not a respiratory medicine specialist, I practice more like a general practitioner. So typically the kind of diseases that I see, asthma has become something which is more rampant these days. A lot of children in the preschool and early school going age come to you with asthma, which is a very, the incidences have gone up. Although I don't have an evidence to that which I have collected, but the ICMR study for last 3 years in around 2006 to 2009 clearly puts forth the data of 14 cities in India, and it says that 2.5% of our population in India are suffering from asthma. Around 4% of our population suffer from chronic pulmonary lung disease. But when you actually talk about these diseases, it's very difficult to attribute that air pollution is the only cause for these diseases. There are pollens, there are other environmental pollution. Yes, significantly air pollution is one of the components that impacts us. To what extent each one of those components impacts health is something what needs to be studied further. As you would know that we in India today do not have a set of measurable indices. Very recently, the government of India has started a national pollution index that they have started looking at from 2015 on. So I hope that these kind of measurable parameters will actually tell us that how much can you accord to each of the risk factor. As I said that primarily I deal with kids and as a general practitioner. My role has primarily been to tell the people I promote wellness and good health rather than making them to come back to me with a disease that I have to treat, right? So one of the few ways that I tell them is practice yoga, do more exercise so that you build your lung capacity in a way that you can actually cater to the environmental pollution in and around you. That's one part. That apart, have a fresh air ventilation as far as possible wherever you are. In an air-conditioned environment, one should be very careful. Typically these days you have the elite segment which stays completely indoors in an air-conditioned environment. It's not that these people don't come back to you with asthma and other pulmonary diseases, which means that the indoor air also needs to be equally purified so that's to ensure that similar kind of pulmonary diseases today do not happen. So today you cannot say that it is impacting only people of the lower socioeconomic strata. It is equally impacting the elite, which means that there is a need to address both sides. So I do advise them on preventions of improving your own personal capacity and take those preventive measures to reduce the pollution in and around the area that you are staying. Say for example, you are staying in a society, please don't burn leaves. Give them a methodology or teach them how they can actually share or send all these biodegradable wastes to a biogas plant where it can be degraded and circulated as a biogas. So we tell them to the extent possible, whosoever is ready to implement and listen. I would like to tell people that your health is in your hands. Therefore, you should do everything to prevent and to fall sick. I don't want people to come to me. That's what is my message. So prevention is better than cure. I think that's what is the message to people from my side. Thank you so much.